Malawi has one of the world's highest rates of people living with HIV across Africa. Foreign aid funding cuts in January of 2025 meant services closed, leaving Malawi's HIV response in pieces, and people, especially those most affected by and at risk of HIV, were left without access to life-saving HIV prevention, treatment, and care services.
Certain services are no longer available in the communities, such as condoms, but also access to services like PrEP and PEP is a challenge.
The Transition Initiative from Frontline AIDS supports civil society organizations and community networks to engage with the government on their priorities for nationally led, sustainable, and equitable health services.
There's country ownership where we are no longer depending on donors, but we alone are able to ensure that we are continuing with investments that we've made towards HIV prevention in our countries.
It is very important for CSOs, communities, and the government to actually sit on the same table when decisions about programs are being made.
Frontline AIDS supports Malawi's civil society and community network to advocate for smarter investments, resilient health systems, and equitable policies grounded in community ownership.
Frontline AIDS have brought us together to provide funding, but also technical assistance to help us to mobilize ourselves as civil society organizations, to look at the data for Malawi, to look at the situation for Malawi, look at what are the realities after the funding cut.
Civil society organizations are also working alongside the government to reduce the barriers that the people from key populations, such as female sex workers and men who have sex with men, are facing when accessing services.
If we do not sustain the funding and also maintain the safe spaces, there is a risk of increased HIV infection, as well as sexual transmitted infections.
The coalition working with the government has become a driving force and a practical model to demonstrate that a sustainable, nationally owned HIV response is possible.
We are in a long-term sustainability phase whereby HIV is being institutionalized into the healthcare system, not to be run as a parallel program, starting from the planning, program level, safe delivery, and we have developed a partner engagement framework.
We have been together in this journey from the onset of HIV up to now, and we have made progress because of the involvement of civil society organizations.
We have to be on the leading role, and the donors should just come in to support where we have the gaps.
So the meaningful engagement and involvement of civil society organizations is very key to Malawi's sustainability of the national response to HIV.
Civil society and communities of people most at risk of HIV have shown they are essential partners in national HIV response. Donors and governments must urgently support them to protect progress and end AIDS in Malawi and around the world.